As many of you know, Southwest Florida is home to a lot of athletes from almost every sport, but that also means there are also a lot of people struggling with sports-related injuries. Here to talk about how cellular prolotherapy may be able to help is Dr. Hauser. He's a prolotherapist at Caring Medical Center. Good morning.
Yeah, good morning, Carly.
Good to have you back.
Yeah, you too.
Should also mention you are also an author. You've written several books. One of them is Prolotherapy, an alternative to knee surgery. Again, this is just one of the many books that you've written. But I love that prolotherapy, and you know, it's your passion. You like helping athletes, which we're going to talk about this morning, and you love just helping people get back to their life without pain, which so many people are struggling with, right?
Yeah, exactly. And then, you know, I'm an athlete too, Carly.
Yeah.
I've done the Ironman 5 times.
You
so
have.
That's not an easy task. But no, I swim, bike, run.
Yeah.
So, and the thing is, it's very hard to get fit. You know, so an athlete might spend a year getting fit, and then one injury.
Ugh.
Every day you're not exercising and you're injured, it takes about 2 days of rehab to come back. So if you're out for 2 months, it's literally going to take you another 4 months just to get to the same level. Crushing
an athlete's dream.
The thing about prolotherapy, though, and PRP and the various cellular kinds of prolotherapy can get the athlete's injury healed in a lot quicker manner.
Yeah, well, and let's talk about that. So the PRP, this platelet-rich plasma, is something I think a lot of athletes may have heard before. So talk a little, maybe, you know, somebody is hearing it for the first time. Explain what it is, though, and kind of how it's related to prolotherapy as well.
Yeah, we all know muscles are red. Muscles have a really good blood supply, Carly. I'm going to use the knee model. All the structures in the knee and around the knee are white. Like, in other words, the cartilage is white, these ligaments on the side are white, even the meniscus is white. White means that it has no blood supply or very poor blood supply. So that means if you have a meniscal tear, it doesn't regenerate by itself. So often the person will go see an orthopedic surgeon, the orthopedic surgeon will say it doesn't repair so good, so you should consider getting surgery. What I'm saying, and Dr. Special and our clinic, Caring Medical Clinic in Fort Myers, is saying you could stimulate the repair by cellular prolotherapy with PRP, which is platelet-rich plasma. So we inject platelets, which have the growth factors into where the meniscal tear is or where the ligament tear is, and that will provide the healing elements that are needed to regenerate or repair the tear.
Now, you're just right there talking about the knee, but is this same, you know, this platelet-rich plasma, can this, you know, be helped with the elbow? Or, I mean, I know a lot of people have neck and back pain issues, you know, feet. I mean, is that the same, would you use the same kind of thing there as well?
Exactly. For athletes, where athletes get injured is at the hinges of the body. The hinges of the body are the joint. So in other words, when you're working out, what happens is the hinge or the joint is where a lot of the force goes. So when one of these white structures, whether it's cartilage, ligaments, tendon, meniscus, labrum, these kind of tissues, even disc tissue, then those are white tissues which have a very poor repairability by themselves. To enhance the repairability so you don't need surgery and you don't subsequently get arthritis in the joint, we inject healing cells. One of the components we use is called platelet-rich plasma into the area to stimulate repair.
You mentioned that word surgery. You know, again, as you said, athletes, you know, they don't necessarily want to go that route. How do you know if maybe this may be able to help, or maybe they do have to go to surgery? Because I love that you guys are honest and say, hey, this may not work for everybody. You may need surgery.
Yeah, there are times where we will get an MRI, and which will assess, you know, the extent of the tear. And we've done lots of papers, so we've done research on labral tears, meniscal tears, and it has a very high success rate of healing with prolotherapy, PRP, without surgery. But there are times where the joint really is all destroyed. For instance, Carly, if somebody had a complete ligament tear, the MRI showed a complete ligament tear, then we would recommend they get the ligament repaired with surgery and then see us if there's any pain after the surgery. Does that make sense?
Yeah, it does. And I think, you know, a lot of people are going to be interested to hear about this. I know they're going to, you know, you encourage, you know, consults as well to see if you're a candidate. I know people are very interested about the cost about this. Sometimes they think, okay, it's just got to be out of my price range. Medicare does not cover it, but you say don't let that stop you from calling or coming in, because you guys are making making this affordable for
yeah,
people.
it's hundreds of dollars. It's not thousands of dollars. And then anybody knows that, you know, when you have pain and you can't do sports, and a lot of us, me included, Carly, honestly, that's like my psychotherapy. No, life's hard, you know, so you work out just to feel calm, and it's my alone time. I'm just Ross the runner guy. So when you don't have that, you know, you're just not as nice as you should be. So prolotherapy, it is affordable. It works really, really good, and obviously it'd be better than getting a surgery.
And I love that you encouraged the last time you were here, you said, hey, go to our Facebook page, see, you know, meet these people who are doing it, trying it themselves, talk to them, find out what their experience was like. And again, though, we're showing your website, kind of the first place to head, your website.
Yeah, exactly. And then read about prolotherapy. We'd like you to be educated. You also could email us. You could actually email me with questions. So you just go to the website. There's a contact. So if you wonder if, like, you have an MRI and you just wanted me to review it and see if you were a good candidate, you know, even before you come in, we're happy to do that.
Dr. Ross Hauser, thank you so much for being here. We love when you're here. We always learn a lot from you. Thank you. We look forward to having you back.